ALCL, or anaplasic large cell lymphoma, is a condition that is very popular nowadays in the media. And I want you to explain to all of you what is this all about. Well, this is a condition that has been found to be more frequent in patients with breast implants. But that has several things that we need to know before getting like a lot of euphoria about it. The first thing is that it has been found that when we have an implant in our patient's body, the patient's body says, oh, this is not mine, I don't like it. So I'm going to do a scar tissue surrounding this implant to isolate it from my body. And that's called a capsule. Every patient that has a breast implant has a capsule. That's normal. But when that capsule starts to get thick, like sometimes when we cut in our skin, we get a thick scar. This is called capsular contracture. And of course we don't like it, because this capsular contracture can be secondary to that excess amount of tissue around the breast implant that puts it hard, and a breast hard is not nice. And also this increase in hardness of the breast because of this breast contracture pulls the implant up. So it looks one side up and one side like natural. It just not look harmonious. So that's why we don't like when that happens in a breast implant patient, meaning we don't like capsular contractures. So they started to try to, let's say, develop an implant that would decrease the amount of breast capsules. And that's why they changed the way they did the first implants. Remember, the first breast implants were done back then in late 1960s. And the breast implants were done with the cover that was smooth. But since this capsule contracture appeared, they started to develop this new kind of implant. And what was the difference with this implant? It had a different cover. And this cover was not smooth, was texturized. And why that cover was texturized? It was sometimes texturized, and even sometimes the different materials like polyurethane was done around the breast implant, trying to, again, diminish the amount of these breast contractures. But with some studies, they start to associate this ALCL condition, the anaplasic large cell lymphoma condition, with breast implants. And so the FDA did a study that lasted 10 years. And in this study, they concluded that this condition, ALCL, was more frequent in patients with breast implants. But it was more frequent in patients with breast implants with texturized breast implants. Exactly why this is happening it's not totally clear now. For now, we understand that the implant is surrounded by this cover, and if the cover is texturized, it gives a chronic inflammation on the breast tissue, and this chronic inflammation makes some kind of reaction that brings up this lymphoma. Today we can use breast implants, but we need to understand that the surface of my implant should be smooth and not texturized, so that this increase in ALCL is not present in me as a patient that have a breast implant. If you have any questions, do not doubt in contact us at www.drrinatriana.com or follow us in our social media. We are very keen to answer any questions. Just write to us right down here where our social media information is present.